Today we're looking at how to use your cervical spine Denneroll at home. The Denneroll allows for a gentle but effective stretch to correct abnormal curves in the neck. And this can assist in the relief of pain and muscle tension through the neck and the shoulders, and has secondary positive effects such as improved blood flow to the brain and better signaling of the nerves in the neck. Your chiropractor will have determined which position to place the Denneroll is most appropriate for you. However, for now, I'm going to show you the 3 most common regions we use. So when you get your orthotic out of your box, you want to make sure that you've got it to the right side. It's embossed in this side here. It says shoulders this side. Now, if you've been given instructions to place it on the lower part of your neck, the key here is to find those really large bumps at the base of the spine here. They're the ones that are most prominent. Push the orthotic in till the peak of that touches that area, and usually orthotic's going to gently touch the back of the shoulders. And the key here is that when you lay back, you should be looking slightly back towards the wall. Now, if it's too high up, you'll notice that you're just looking straight at the ceiling, not actually looking back. So the key here for the lower part of the neck, have it almost under the shoulders. When you're looking back, you should be looking back to the wall behind you. Now, a key here is to have a slight gap under here, because it's the weight of your head that provides the traction on those ligaments to ultimately get the change. If your head's touching, I have an example here of what you can do with, say, yoga mat, by lifting the body and the Denneroll up off the ground slightly to give yourself a bit more room. Now, if you've been given instructions for the middle of the neck, you want to find those bumps and you want to be just above or on those bumps now. And so when you're on it, you'll notice that your eyes, instead of looking back at the wall, are probably looking at about 30 degrees. And similar rules apply here, where you want to have just a slight amount of give under the head, about a finger width in that position. If you've been given a recommendation of the upper neck, you bring it then above those bumps. So you shouldn't be on any of the large bumps in your neck, and you're pretty much looking directly at the ceiling for that one. Now, once you've finished laying on the Denneroll, an important consideration is how you get up once again. And for this one, you don't want to just sit up straight away. You actually want to roll your body to the side, take a moment. Sometimes if I've been there for 20 minutes, I might even remove that and then just lay back down for a moment and then come up. That's really important, because it can get a little uncomfortable if you've been stretching a lot of those tissues that haven't stretched in a long time. And that helps give your body a chance to reset, and then you can get on with your day. Now, with your Denneroll, you should have also got a set of instructions here. So if you ever get stuck, always ask your chiropractor, but you can refer to this for some help. The key here is on the back, we have all the necessary time requirements. Initially, you're only going to start at a couple of minutes, and then slowly work up a minute a day until you get to 15 to 20 minutes. And it's beyond about that 13-minute mark where you start to get the true effect of those ligaments starting to remodel and reshape, so you can get a more permanent correction